I'm Dr. Matthew Halpert, founder and CEO of Immunocine. I've spent most of my life in the space of cancer and cancer immunotherapy, and today I'm here to answer some of your questions. Go ahead and click on the different chapters below to get to your specific question, and let's discuss. Now what I'd like to do is talk about a few generalities about cancer and treating cancer. There are, of course, a lot of external factors that can ultimately drive a cancer to form in a person, but at its core, it's a mutation in the replication process of the cell. Your cells naturally divide. As we age, some cells will die off and other cells will then replicate. One cell will become two, and it should stop. And this is how we continue to live our lives. In the situation of cancer, there's been a mutation. Something has gone wrong and the ability to self-regulate is gone. And so when one cell becomes two, instead of stopping, it now becomes 4, and then 8, and then 16, and eventually this mass of cells is something we call a tumor. Now, it's a problem that needs to be dealt with. Because cancers are continually evolving, very often a treatment that used to work stops being effective. And the reason for this is that the tumor has simply gotten rid of what was being targeted. It changed to express something different. It has done something to no longer be visible or attackable by whatever that treatment option is. So how does the Immunosine treatment overcome this? What's different here? One of the primary differences is that when we load your immune system, your dendritic cells, with your cancer information, we give it all of the information. That's not just what the cancer looks like today, but that's everything within its code of what it could be in the future. Because of this, the immune response generated is widespread, targeting multiple markers and proteins expressed on that tumor. As the tumor changes and evolves, your immune system can now evolve with it. This robust, targeted response makes it much more difficult for the cancer to ever become invisible again. The way Immunosine utilizes your dendritic cells allows us to make a complete immune response against your cancer that's not only effective on day 1, but is able to evolve with the cancer and stick with it as it tries to fight back and get away. This may be a basic question, but it's an important one. What is immunotherapy? At its core, immunotherapy is any treatment designed to educate and/or activate your immune system to eliminate a threat. Many cancer patients will be told by their doctors that immunotherapy will not work for them. This is a bit of a misleading statement, because what does it mean? This would be like telling someone that a diet won't work for them. What does that mean? What kind of diet? Immunotherapy at its core is simply the education and/or activation of your immune system to target and eliminate a threat. Currently, the FDA-approved most prominent immunotherapies consist of either CAR T-cell therapy or checkpoint inhibitors. CAR T-cell therapy is the genetic modification of your T cells to target a single antigen being expressed on a cancer. In some situations it can work, but in most solid cancers this fails to get the job done. Checkpoint inhibitors are a drug designed to effectively repower an educated immune response. When your immune system is working to eliminate a threat, as this fight goes on, it will often raise checkpoints as a failsafe. It will raise these brakes, suggesting that maybe it needs to be turned down because this fight has gone on for a while. Tumors have learned how to hijack and utilize this system and turn off those immune cells. Checkpoint inhibitors get in the way of that, thus allowing the immune system to continue fighting for longer. Of course, this only works if those specific markers are being expressed, and if you already have an educated, activated immune response going. For many patients, these are not the case, and therefore a checkpoint inhibitor will not work for them. In this situation, Sometimes a doctor or other medical professional will tell the patient, immunotherapy will not work for you. What they should say is that the current FDA-approved options in immunotherapy may not be effective for you at this time. That does not mean that your immune system cannot become engaged and start fighting the cancer. Monoclonal antibodies are designed to target very specific markers potentially being expressed on your tumor. When they find that marker, they will bind to it and hopefully recruit immune cells to the area to hopefully do a job and eliminate those cancer cells. While this can be potentially effective at delaying cancer progression, historically it has not been effective at eliminating cancer. Another option, of course, are dendritic cells, which are uniquely capable of seeing the entire milieu of what a cancer is and or could be. Dendritic cells are also specialized to activate a complete and physiological immune response. Of course, the caveat to this is that the dendritic cells must be used correctly, and that is something we think we've got here at Immunocine. A normal function of the immune response is immunological memory. When you get sick, for example with the flu, and your body is able to overcome that flu and fight it off, at the end of it, those immune cells which rid your body of the virus quell down into a small population of what are called memory cells. These cells will continue to survey your body looking for that same threat, attempting to re-enter it. This is why, after dealing with an infection and overcoming it, you have a window of time where you're not really able to regain that same infection. Your immune system has learned what the problem is and is now ready to protect you against it. The same can be true for cancer. If you get a proper immune response that eliminates the cancer, you very often can get immunological memory that remembers what that cancer looked like and will continue to survey your entire body looking for any potential relapses. This is a critical component to any properly engaged immune response. There are, of course, a variety of treatments in both the standard of care space and the alternative medicine space. Some have more scientific background than others, and some may be more amenable to helping you fight cancer. The question, of course, is, can they actually rid your body of 100% of those cancer cells? And while the answer is yes, it is possible, it's very often not practical. Most of these treatments are not specific to your cancer, but are rather a broad-reaching scope. For example, diet. Diet can be very important. Cancer's primary fuel is glucose, and if you're eating a bunch of candy and simple carbs, you're literally feeding cancer growth. So moving to a more keto-rich diet can be very effective at delaying cancer progression. Will it completely eliminate the cancer? Probably not, because at this time you don't have anything effectively going after the cancer and fighting it down. That's where a specified immunotherapy protocol like this can come into play. We hope we've been able to answer several of your questions here, but we pride ourselves in being transparent and responsive. And if you have more questions that weren't properly or completely addressed, please do not hesitate to reach out to us.